on the second breakout, this time from the random groups we were in without a set agenda. I hope it was a good opportunity to just chat about things on your mind without necessarily a set goal. But we found, at least in our small group, that was a really nice chance to connect with people. And so I think we don't have that much of an agenda, except to have anybody who would like to share very brief points that came out of your chats that you think are ones that others should hear about, and that might then go towards where do we go from here. Please just unmute yourself and please share.
Okay, I'll make a very brief comment. So I'm from the dataset availability group. My name is Jun Kim. So before we start, I'm really happy to be part of the conference. I'm calling in from Korea, where it's 4 in the morning. So conference is exciting, but next time you hold this kind of big meeting, it'll be nice if you can hold it in the, say, in the morning local time, then it'll be at least a more reasonable time for me to join. Okay, about the things we discussed, we said it's about the data availability. There are a lot of public data sets that are already aggregated and available. So the question is, what do we do with the private or semi-private data? Of course, it's up to them to decide to share it or not. They may choose to share it for collaboration or comments replication, or even to create a much bigger study that combines several data sets. For them to be able to do it, they should be able to search what kind of data sets other people have. So one way to go forward with that would be maybe the APPAM can create a list repository of ongoing projects where people can volunteer their information, so other people or students or other scholars can look them up and ask about their availability. That's one possibility. Another point that are brought up is that with the available data sets that are available, there is some inherent endogeneity. In other words, the available data sets are not all equal. So it depends on the institutional strength of each country. So there are some countries, especially developing countries, that have not made detailed data available because of weaker institutional strengths. So that's one issue. And another thing is that even with the available data, the reported information, say number of patients or number of deaths, may be biased and it may have been influenced by the political or other interest by varying degrees. I don't see this being mentioned in many of the international studies, but I think this should be seriously considered. It's not clear how that can be addressed yet, but it should at least be considered.
Thank you.
Okay.
Yes. And just on the chat, we've had several questions and suggestions, and I just want to highlight one that Tara put on there, which is a question that might be coming up is, how do we continue these discussions? And we want to point people, if they aren't already on, to the APPAM Hub Slack channel, which is a great innovation that Tara and team came up with for giving a venue for people to continue these discussions asynchronously and to share resources and find community. So just want to plug that before we.
Sorry. So, how to get to that? I don't know how to get to that. A Slack channel? Is that on the APPAM website?
Would you like to tell us a bit?
You can, I just posted the link in the chat box, but yes, it is also on our website, right at the top in red bold, and you don't need to be a member to join.
Thank you.
So in our group, we started off with just talking about our backgrounds, and from that we focused on research methodologies, and one of the things that was brought out was that designing surveys was difficult because by the time you develop your questions, they become obsolete because of so many changes happening with the COVID-19. And institutions are prioritizing COVID-19 research. This was probably brought up before with the methodology in the other groups, but You have to rely on secondary data now, and what you are able to post is publicly is challenging. A lot of times they have to use administrative data. You can't interview anymore because of the COVID-19 restrictions. I mean, you can, I guess, virtually, but it's more difficult. People like to interview one-to-one. And then we need to associate data with experiments that are out there already nationally. And finally, we need to try to appropriately relate to other disciplines because they're trying to merge. The difficulty lies in where you describe things that might be different. So everybody needs to be on the same page when you're talking about other disciplines. And now universities are asking for, and journals, short responses rather than detailed, long, 30, 40-page research papers. That tends to be the new trend. And they're also asking for people to partner and recruit practitioners, policymakers, and researchers to come together and write papers. So that tends to be the new trend now. And that's it.
This
Thank
is
you.
Louise. This is Louise. I'd like to give very brief comments from our group, which was on applications and future research. And there were 3 points that I thought were really very interesting. One is that the agencies that are doing evaluation of performance are now asking new questions. Did their recipients have access to, for instance, the CARES Act? Were they able to get access to the CARES Act? Secondly, since most interaction has been moving online, how has that changed the relationship between the administrators and the staff, and specifically between the staff and the clientele that they were providing services for? And then thirdly, what was very interesting to me, because I'm interested in international research, is are agencies doing comparative research how are other countries responding to the same problem in their specific social programs? And this, I think, also leads to a whole new set of questions. And then finally, the question that research findings need to be presented in a way that they are iterative and would be reviewed and updated the next go round. Thank you.
Thank you. Any other
This
groups
is-
with thoughts?
Sure, this is Derek Kanekis. I'll report back from the international group. We had about half of the people in our group did international, the other half didn't. So that's the impact of randomization. The general questions that I think have popped up, there were some big broad ones about the impact of US leadership kind of internationally in global crisis and the lack of it in this case, both at the national and at the international level. So is there comparative studies to be done? What's that role? There's certainly some discussion as well of the data standard problems with international and comparative, what's being counted and how domestic research in the US. We all thought there were some applications to our own research areas, just learning from what other jurisdictions had done. I do subnational, so I'm very interested in how cities responded being hotspots internationally, since we saw those very much as the key policy actors here in the US. And then states and regional governments, so how do you deal with kind of the regional hotspots? But that idea that the international stage, given that this is an event that every place is dealing with simultaneously or more or less simultaneously, suggests that there's enormous scope for using that sort of laboratory out there of global governments dealing with the same problem under more or less the same conditions. I'll leave with that.
Thank you.
So we had government partnerships. We defined this a couple of ways and then tackled those ways. individually. So very briefly, first, we focused on contrasting the type of partnerships between governments that we're seeing in, for example, in the Northeast in New York and the six states, the 5 states surrounding New York, where 6 friendly governors are working collaboratively on reopening society and the economy. We identified some real heterogeneity out there in parts of the country regarding partnerships between governments on policies and on communication. So challenges intra-region and intra-state. The example we used was the absence of partnerships in and around Texas. So counties not communicating clear rules regarding social distancing, the need for masks, a problem exacerbated by the fact that some city governments cross multiple counties. Nonetheless, despite this problems, there are some interesting partnerships that pop up regionally, again, using Texas, regional governments working together, being shepherded by institutions like the Institute for Urban Policy Research. The second topic was getting the partnership between governments and academia, getting good research to decision makers. So this crisis, the pandemic, is really putting a spotlight on the absence of a strong government to academic bridge, getting research that it matters to decision makers. Ken, at HHS, you suggested that you guys benefit from having established relationships with brokers like contractors, third parties, the Mathematicas, the RANDs, that can that are a little more nimble, but not everyone has those types of resources. And this is just amplifying that situation and making it clear. And then just briefly, the need to be forward-looking regarding partnerships. There's going to be a vaccine coming. It's unclear that we as a society are ready to sort of marshal the collaborative atmosphere, the partnership environment that's emerging toward a national or a global solution. So when a vaccine shows up, are we assuming that the partnerships that are working are going to provide the architecture needed to distribute, to educate people on the need to take a vaccine? If we're assuming that that collaboration via partnerships is in place, we might want to think twice.
Thank you. And I also want to be mindful of people's time, since we are beyond the time we promised that we would keep you, but also have a few minutes to hear from all the other groups or whoever would like to. So I think we are, we've had a lot of information shared, a lot of networking opportunities, and it's thinking of how we take advantage of these connections we've made. So I think that now might be a good time actually to move the discussion onto the hub, as people want to get more concrete about suggestions and sharing of information and connections that might have started through this. So I think this might be a good time to say thank you again to Tara and team in particular for putting this